Good morning, everybody. As Warren said, I'm the Chief Exec of SOPA TVS and I'm the Chair of the Board here at VCSE Sector Northwest. I'm really pleased to welcome you to this first event in our Northwest Festival of Ideas. It's a series of events. Today we're focusing on inequalities. And then on the 28th, we've got a conversation about infrastructure. And just to say, I've just put in the chat the actual proper details on the titles. And then followed on the 12th by our AGM. And it's a session focusing on future levers for our sector, including funding. The fourth event, which is currently we haven't got a date for, is going to be with an audience with our Metro mayors, where we really want to have a conversation, I suppose, about what does Build Back Better mean. Not so keen on the term BBB myself, but I'm sure that what we want to talk about is what better, fairer and greener means to us and our sector, and see what influence we can have over the Metro mayors. And I think we know that some of them are in an election year coming up, so it is our chance to influence in the run up to and try and get them to commit going forward. So I think at the moment, Warren, you're thinking about just after Christmas now, aren't you? Making sure we do it before Purdah.
Yeah, for some reason they're not available at the moment, Alison, I'm afraid. Yeah. No,
well, for some reason, exactly. Well, as I am from the city region where we're all worth £7.80 each, yeah, we have got a lot to talk about. So I'd like to say a massive thank you to Warren and to Michael and Karen and Martin and Kiri and Andrew and all the team at Voluntary Sector Northwest for all the hard work in organising these events. I know it's been a massive task, and doing something like this online, I'm hopeless online, so I'm really impressed. And I'd like to say thanks to all our speakers and everyone who's attending. And I suppose one of the things about digital, it does enable more people to participate, doesn't it? So hopefully it's going to be a fantastically lively discussion. Hope you're going to join us for the other two events. Like I said, they're in the chat. The booking details, you can look on Twitter, you can look on our website at Voluntary Sector Northwest. Really hope you're going to be joining us. I'd like to say thanks to my fellow board members who are also here today, all playing a role. And now, because otherwise I could talk for ages, I'd like to pass you over to Warren, who's going to introduce the session today. Thanks, folks.
Thank you, Alison. So today is COVID-19 recovery, and in particular, we're looking at inequalities issues. I don't think any of you need me to spell out how COVID-19 has accelerated the ongoing social crisis and widened inequality, health, economic, in all the worst ways we could have ever have dreamt of before this year began. And we know certain communities have been far more deeply affected than others, and the intersectionality of some of those characteristics that have been affected, it's just not been well, it's not something we expected when we began this year. On the positive side, it has highlighted the issues we have known about and talked about and lobbied about for a long time. So I don't think there's ever been a higher profile for equalities issues. It's not for the right reasons, but there is an opportunity within that to lobby for change that we have been talking about for a long time. We also know lots of voluntary sector organisations are struggling. We're at a point now where it is wave 2, certainly in the Northwest. We have spent our reserves generally. We have used the cash available from councils where it's been. That is gone. We're not clear where the cash is from the NHS going forward. The National Emergency Trust Fund, which we're lobbying for them to get more money in their coffers, is currently empty, but they are beginning to look at it again. And we think a lot of the funders, like the lottery, have spent much of their COVID resources already. And on top of that, we're ending furlough. We've got an economic crisis looming. And as we say, some of us are worth £7.80, as Alison put it so succinctly there. But in terms of today's event, there's a conversation to be had. We know that conversations around our sector, there's a number of commissions going on. I think the K word, Mr. Kruger's report, has flagged up a lot of interesting ideas. It's revived a number of old ideas in new ways, and it's made suggestions we possibly don't agree with in other areas. But the spotlight is on the sector, and it needs to be raised. We know we've been a key part of how communities respond to COVID. So in many ways, the the spotlight is on the voluntary and community sector as much as it is on inequalities issues. So please bear that in mind as we go through today's agenda. We're trying not to do a load of talking. We've got some pieces early on. Key spots are from Lynn Collins, who is the Northwest Trades Union representative, and who sits alongside me on the Northwest Leaders Board when it meets, and I think there's a move to get it to meet again. So the Northwest is back on the agenda in very much a strong way. So there's 3 agendas there, back in profile for us to think about as part of today's conversation. Lynn's going to talk to us about socio-economic inequality and community activism. And then we'll hear from Natalie Creary, who's going to talk to us around structural racism in health inequality. And that'll be followed by Fazana Khan, who's kindly agreed to talk to us about the role of racism and racialised poverty in health inequality. And she's also going to talk to us about trauma-informed practice to inform and improve the way in which we support communities' health and combat inequality. So 3 massive headline areas, all online, all with no more than 10 minutes each, and I'm taking up the time. So most of the rest of the time will be for us to talk and come to some conclusions about how we move forward on this agenda. So I'll not witter on too much more, but I'll introduce Lynn Collins, who's going to talk to us about socioeconomic inequality. Just to say, I've mentioned her role as Northwest TUC. She's also the Liverpool City Region Advisor on Fairness and Social Justice in Liverpool City Region, and has just completed a secondment into the Combined Authority, which we would wish as a voluntary sector in Liverpool City Region had continued for many, many more years, but secondments can only be so long. She's also chair of Health Watch Liverpool, so she knows what's going on the ground, and she's an advisory board member for the Work and Equalities Institute at the University of Manchester. Right, I'll hand over to you, Lynn. I'll look forward to hearing you talk.
Thanks, Warren. The host has spotlighted your video for everyone. That's fine. Would you like to unmute yourself? I've done it. I've unmuted myself. It's sending me messages. Thanks, Warren, for the introduction. And yeah, I've just completed a secondment to Liverpool City Region. I'm just back at the TUC. The secondment was to focus on fair work, decent work, and improving relations with a range of sectors. None of us were expecting the pandemic, and that changed things slightly. So I'd worked really closely with the sector over in Liverpool City Region on a number of initiatives, including setting up LCR cares, which helped to channel quickly those vital monies through to the sector. I wanted to just tell you a little bit about the TUC. So it's a trade union congress. It's a congress of individual trade unions, 48 trade unions at the moment. Numbers change slightly from time to time. And here in the Northwest, we represent about 800,000 workers across the sector. We're kind of unique in the Northwest in terms of trade unionism. First of all, the Northwest was the birthplace of trade unionism, as it has been of many great social movements. So trade unions started here. The Northwest is also the area that has the highest level of density of trade union members. And it's also the area where we have the kind of widest coverage of trade union membership across workplaces. So there's something about the Northwest, I think, that we'd all agree, it drives people into an activism. On slide 3, I was just going to highlight the positive relationships that we have with the community and voluntary sector nationally and here in the Northwest. So nationally, the TUC works really closely with a number of national bodies representing the sector, and over the years have developed concords and accords and joint documents and joint policies with the sector. Here in the Northwest, I think we've got a really strong history of working together that goes back probably to the period of austerity, where we drew together and signed a joint agreement around the relationship between trade unions and the voluntary sector, when we knew there would be pressure on for volunteers to replace jobs as austerity kicked in the sector. And just prior to my secondment, Warren and I were in the process of kind of redrafting that for new times. We weren't expecting these kind of new times, so it probably needs a little bit more work on it. but that's one of the key areas where we have drawn together. At sub-regional level, we've had collaboration, particularly in Liverpool City region, where VS6 have always welcomed me as a TUC representative to join with them on various campaigns. And obviously individual trade unions organise in the sector, and particularly Unite in Unison have strong national voices and regional voices for members working in the sector. Warren touched on the fact that we sit together as social partners, both on the North West Leaders Board, but also on several other panels as well. And more recently, I've been really pleased to work with the sector to challenge some of the job replacements that we've seen attempted during this global pandemic. In particular, we issued joint statements about Boots calling for volunteers to do COVID screening, and for transport champions to replace staff on railway stations. And it was the sector who came to us as trade unions to work jointly with us on those things. So then COVID came, and we were faced with a health emergency. Some of us have coped with them before. An economic shock, some of us have coped with them before. But I think the combination of the two things were something that none of us had ever experienced before. And that really created a really sharp focus, as Warren said, on some of the existing inequalities in our society across the Northwest, and looked at making things worse for many, many people. Did it move the plates of our society? Well, I would argue that it possibly has. And on the next slide, I've got a quote from the Financial Times. And if we've moved the Financial Times, I think we've moved a little bit. So that's on the next slide, on slide 4. And I can't remember it, so I'll have to wait for it to appear. But if the Financial Times are saying that society's moved, I think we have to seize the opportunity to move ourselves with that. I think there's also an opportunity to work together going forward to capture the best of the activism that has come out of this crisis, and some of the things that have run alongside this crisis. So I would touch on the activism around the Black Lives Matters movement, the activism around holiday hunger, the activism around the Me Too movement, as all being examples of where there's been an anger and an activism created, and an opportunity for trade unions and community and voluntary organisations to work closely at local level to capture that and build that into a movement of sorts at local level. The Financial Times quote said, "If there is a silver lining to the COVID pandemic, it is that it has injected a sense of togetherness into polarised societies. But the virus and the economic lockdowns needed to combat it also shines a glaring light on existing inequalities and even creates new ones. Beyond defeating the disease, the greatest test of all countries will soon face is whether current feelings of common purpose will shape society after the crisis. As Western leaders learned in the Great Depression and after the Second World War, to demand collective sacrifices, you must also offer a social contract that benefits everyone." So I think trade unions and the sector have common challenges. I'll drop into the chat after this our TUC report on a better recovery for the Northwest, and please do have a look at that. We talk strongly about the need for a stronger voice at work, and your sector talks strongly about the need for a stronger voice in civic society. I think they're two sides of the same coin. We talk as trade unions about welfare, defending welfare and public services. You're the people who fill the gaps that have been left by austerity, tackling the real impact of universal credit and PIP. And you're the people who have the expertise and face the lived experience every day from people who suffer the consequences of attacks on welfare and public services. We talk in trade unions about safe, satisfying and dignified work. And you every day talk about lifting families out of poverty and improving the life chances of people. Work used to be a route out of poverty. It isn't always now. And your experiences in dealing with food poverty will have seen that many people who are in work are living in absolute destitution as well. And our post-pandemic work, looking at building a class unity and a new deal for working people, I think sits right alongside your aim to build community unity through a much more participatory democracy. So I'm not going to answer any questions today. I'm just going to throw in some discussion points. And these are on slide 6. I'm looking at mine and I haven't got a clue where yours are up to, but you'll get them in the post. So first of all, how do we link local trade unions with local community organisations around common themes? I highlighted how food poverty and low pay are now inextricably linked. Housing and tenants' rights, I think, is another example. There's some good examples out there already. In Manchester, I know that the Trades Council are working with the Acorn Tenants Union, and for a long time have worked with Greater Manchester Law Centre. In Liverpool City region, the City of Liverpool Football Club have developed a community hub and are working with a range of partners around these kind of issues there. Second discussion point is how can we share our experience, our skills and our knowledge to benefit our communities. So a couple of examples I'd give around that. First one maybe is Kickstart. Coming down the line, something that I know community and voluntary organisations are looking at being actively involved in. Can we bring some expertise around workplace rights and responsibilities into that employability strand? We've been talking to Vola and others in Liverpool City region about this. I mentioned our Union Learn project. I mention it because it's under attack. The Tories have just announced that they're withdrawing all funding for Union Learn. And again, I'll use this as an opportunity to drop in the chat a link to our petition to save Union Learning. But we've developed online learning tools that surely your organisations may be able to benefit from. Your sector's absolute expertise in welfare rights advice and support is something that I think trade unions will benefit from. More and more our members in work are facing challenges like universal credit, and we don't have the expertise around those things. You have the expertise and maybe we can share that. So I've talk about political education as well. I talk about it with a small p on the slide. I think the small p is perhaps we could pool together our resources so we can help our communities navigate politics a little bit better. We can kind of enlarge the p a little bit to start to think about why what's happening in our communities and our societies is happening. But I think there's different levels that we can operate at, and we wouldn't push anyone to a level they're uncomfortable with that. We've talked about developing a common narrative about not going back to what we had before. And it'd be great to think about ways how we could bring that together. And as Alison said in the opening, especially here in the Northwest in the run-up to Metro mayoral elections next year, I think having a kind of common agenda that we could focus on would be excellent. And finally, we've talked about how can we best connect community activism to create more participatory democracy. How can we connect our trade unions at local level? Yes, we've been very inward focused in the trade union movement inside our workplaces, looking at the day-to-day problems. I think it's time to lift our heads and think about how we can better collaborate and work outside of our movement and alongside our communities. Trade unionists should be volunteers in their community. They volunteer in their trade union and they can volunteer in their community. And I think we can start to create discussions and debates there. So they're questions I pose more than solutions. 10 minutes doesn't give us time to find the solutions. You know, we've seen a spotlight shone on our society over the last 6 or 7 months that many of us knew already, but I think has highlighted to some of our potential new allies in our communities. We've generated volunteering in communities, but we face continued pressure, particularly in terms of resilience and survival. And if we can pull together resources now, I think it's a real opportunity for us to build that collaborative approach at local level that starts to raise the issues about, does our democracy fit for the type of challenges that we face at local level? And if it doesn't, what are people going to do at local level to rise up and challenge that? I'll just finish by saying I don't think it was missed by many in the sector that Andy Burnham's first speech this week was delivered on the site of the Peterloo massacre. He shifted a little bit. I'm not sure whether it was to the left or the right for the Bridgewater Hall speech, but we do have a history and heritage of communities coming together in the Northwest. We were the birthplace of trade unions, the birthplace of cooperative movements. The Communist Manifesto was written here. We've got a lot of heritage, and I think the time's right for us to re-collaborate to tackle some of the challenges our society faces. So I hope that was helpful and provocative.
Thank you very much, Lynn. Always wonderful to hear you. I didn't know we'd go back to 1815 there, but that was well put. I think, you know, comments from outside the Northwest have been very much, there's never been a more positive time to be talking about what devolution looks like. I thought that the agenda had gone, but seeing Andy Burnham the other day, I didn't realise where he was standing, but it feels like that conversation of how about communities and participation and democracy looks like is very much there. So I think if we can maintain Lynn's suggestion, it's hold the questions in mind and ask those questions of partners and public sector and leaders right across the Northwest and nationally. I think that's wonderful. Thank you very much, Lynn. I'll try and move on quickly. We've run over a little bit, but I think it was well worth it. I hope you all appreciate that.
And I'm just going to drop
Lynn,
some links into the chat before I leave.
Thank you, Lynn. Thank you. I'll see you soon. Right. Next up is Natalie Creary. So she's got 10 minutes. I'll try and keep Natalie to 10 minutes. Natalie's the director of Black Thrive, which is a partnership between statutory organisations, voluntary sector and local communities. So the purpose of that is to reduce mental health inequality experienced by African and Afro-Caribbean communities. Her work emphasises the importance of prevention and seeks to address disparities across social determinants of health. Natalie's going to talk to us about structural racism in health inequality, looking at the impact on wider determinants, its impact on research and our existing evidence base, and therefore our response, and what should we be doing differently. So I'll hand over to Natalie. Thank you for coming today, Natalie.
Hello, and thank you for inviting me. So I suppose when we think about the kind of COVID-19 pandemic, it has shone a spotlight on inequalities. And I think similarly, the death of George Floyd, it's kind of increased our awareness of the impact of state violence. And I think the global awakening to structural racism is welcomed, but there's a risk that we won't achieve the change that we want to see if we don't do enough self-reflection and start to think about the inequalities in the context of kind of structural racism and other systems of oppression. So when we think about also some of the reports that have come out as a result of kind of COVID-19, you know, there has been a lot of emphasis on the need to really focus on narrowing the inequalities gap. So, for example, if the report most recently produced by Marmot, you know, it's important that we work towards every child having the best start in life. The report that followed the COVID-19 inquiry into the experiences of Black, Asian and minority ethnic groups, it spoke about racism, but actually when we started to look at what the recommendations were, it sort of stopped at we need to focus on inequalities. So there is something about the public health literature in particular that continues to remain silent on this agenda. And so I think it's really important for us not to hold back and to, if we really want to think about how we make that difference, I think focusing on kind of structural racism is one way of doing that because it's something that we generally haven't done historically. And then when we're thinking about racism, I think that there is, again, another risk that we get a bit sidetracked by focusing on interpersonal levels of racism. So, you know, we end up throwing resource at kind of unconscious bias training, which often provide quite simplistic explanations of power and privilege. And, you know, these training courses may help people to better visualize racial hierarchies, but it seldom tells us about how it manifests itself in our decision making, our actions, and so forth. And neither does it really give us a sense of the consequences that this might have for Black and brown bodies and other marginalized groups. So if we're really to kind of stretch our minds to understand inequalities, we really need to do this in the context of structural racism, in terms of how that how it's shaped through legislation, policies, processes, and resource allocation. And I think it's also remembered that all of these things create an environment where Black and brown bodies are disproportionately neglected, excluded, detained, restrained, and killed. And what we also have to be mindful of is that well-intentioned interventions can and do harm. So in terms of when we are thinking about how do we address inequalities, we need to be asking ourselves, how is racism and other forms of oppression preventing certain groups from thriving? And what are the structural shifts that are required in order for us to achieve a vision of a more equitable society? So if you want to answer that question, I always say that you're not able to answer this by yourself. So if you don't have lived experience, it's very difficult to speak on these issues with any level of authenticity. If you have lived experience, that's really important. But again, we need to be transparent about who we're representing, because we're not a homogenous group. And so it's important for us to engage with people who have lived it, but also people who are living it now, and recognize the influence that factors like space, place, and time will shape our experiences of very similar challenges. There's a real importance for us to work in partnership, but these partnerships need to be equitable, honest, and genuine. And when we think about the sector, the breadth and depth of the impact that the sector has is variable, if we're honest. And when we also look at how resources are allocated, they're not equitable. And so when we reflect on our experiences of the pandemic, funders and the government were, really kind of trying to get funding out as quickly as possible. And that kind of sort of set the tone for like this race for resource. And the challenges for a lot of Black-led and other minority-led organisations is that we are generally quite small, and we weren't able to really respond to these calls because we saw an increase in demand of our services, and we seldom have a kind of fundraising team. So what we found was that a lot of white-led organisations who did have the capacity were receiving the funding to deliver intervention on behalf, or for, Black, Asian and minority ethnic communities. But one of the difficulties with this is that they didn't necessarily have the reach into these communities, so would then approach organisations like myself, who would be asked to do the heavy lifting in order to be able to deliver on their outcomes for their particular funding bids. So I think that there is something about how the sector thinks about how they work in partnership with Black, Asian and minority-led organisations, because often there is a real reluctance to remunerate us for our time. And I think for funders need to think about how they can create benefits for communities beyond just the beneficiaries of the project. And I think another thing for funders to think about is that if you're shortlisting applications and all of the applications that come through are from white-led organisations, when it's trying to address an issue for Black, Asian and minority ethnic groups, there's probably something structurally flawed with your process. And so you need us, essentially, you need us to work with you, because today I think the sector, and I'm thinking about the voluntary sector and the public sector, have really demonstrated that they haven't been able to narrow the inequalities gap. And I think it's really important for partners to understand that we have power and agency despite the stresses that we are exposed to on a daily basis and the traumas that we are exposed to. But I think one of the issues is that the people that we try to work with, or who approached us to work with them, are very reluctant to share the power. And so what I would say is, don't assume that we don't have the capability, the capacity to lead, or the interest. But what is really important is that you use your power to enable us to do that for ourselves. And then I always sort of bang on about the kind of evidence base, but this is also very biased and structurally racist. It's very good at describing the problem, but there's no surprise that we haven't reached a solution because it's often framed from a deficit perspective. So I would challenge anyone to find research in the literature that, you know, shows you what's great and all the assets that Black people have. So we tend to be kind of quite hyper visible or invisible in the literature. And there's also a lack of representation from the people who undertake the research. So I think, again, we really need to think about improving representation and remembering that this knowledge that is produced becomes truth, because that is then used to shape our policies, our practices, our processes, where resource flows. And so I'm not suggesting that we abandon the literature, but I think we need to be more critical of it beyond how big a sample they used or what statistical technique. But we really need to think about the positionality of the people doing the research, to critique it from a cultural and a political as well as historical perspective, so that we can really understand it, again, in the context of these systems of oppression. And it's so important that this knowledge is supplemented by people's lived experience. And in our work, we are kind of testing a model of community research, which really enables us to access information in areas that we perhaps wouldn't normally be able to reach. And I think it's also really important that we think about, you know, who is the expert? Is it the person with lived experience? Is it the researcher or the professional? And I think predominantly we tend to lean upon the professional and the academic, but actually we mustn't silence the voices of those who are most marginalized, because we can't do this without them. So in conclusion, I would say that when we're thinking about structural racism, rather than remaining silent or avoiding the topic at all costs, it's so important for us to confront our racism, to be curious, and to feel compelled to learn more and do better, and approach the journey to be anti-racist with humility, and to really think about, this is about not just representation, but participation. You know, empowering communities is about giving them the power and not having control. And it's really about collaboration versus competition. So if you want to find out more about our work, you can find that on our website, which is www.blackthrive.org.uk.
Thank you very much, Natalie. It's something we need to be picking up right across the Northwest. I think we've started some conversations in some places, but we certainly need to do more. So thank you very much for that. It was really thought-provoking and helpful. Thank you. We're running behind a little bit, but if I introduce Fazana Khan now, she's going to be asking. Fazana's the executive director and founder of Healing Justice. Her work builds on building community health, repair and self-transformation with communities of colour and other marginalised and underrepresented groups. The presentation is on the role of racism and racialised poverty in health inequality and the potential in trauma-informed practice to improve the way that we as a sector support community health and combat inequality. So if I hand over to Fazana. Thank you for coming today, Fazana.
Thank you so much for having me, and thank you everyone for creating this space. I want to say that firstly, full disclosure, I wasn't aware of, I'm going to speak to what I have prepared for. I think maybe there's just been some misunderstanding around the framing of what the presentation is, but really I'm going to talk about and build on some of the things that Natalie and both Lynn have touched on what is going to be equitable participation for communities that are marginalized, that experience harm, who experience disproportionate public health inequalities, and how do we move towards participation beyond performativity, and actually move towards a movement-based approach to health and access to health. So I think those are the kind of key things that I hope to be touching on, and they'll definitely talk on racism as well as trauma. I think two things both Lynn and Natalie rightly touched on is that health is absolutely a unifying area, and it's absolutely, you know, I think it's undeniable the level of kind of movement-based approach that the Northwest has had, and thank you, Lynn, for kind of reminding us of that. And so it's a really, I think that when we think about public health, I can't imagine why we don't respond and think about public health in a movement approach, given that all of us are patients, even if not all of us are practitioners or health professionals. And so what does it mean when most of us don't shape access to public health, that most of us are actually erased and ignored, and that our bodies are not even considered when we think about what a healthy body is? And that's not just on the basis of race, but also in terms of gender, in terms of disability, in terms of chronic sickness, in terms of class. So it's really, really important that we think about what it means in this moment where COVID is absolutely reminding and revealing that there are social and structural implications of how society is engineered, has impacts on our body and has impacts on the quality of life that we have, and is such a profound determinant of whether we live or not. And you know, when we've been having these conversations around COVID and the disproportionate deaths, it's been discussed often by the government, but also more broadly in civil society, as if you know, Black and brown bodies are dying disproportionately in some arbitrary way, as if it's that, you know, something within our bodies is the reason that we are, you know, disproportionately dying and being impacted by COVID, as opposed to relating it to the impact of trauma, not just present day, but also generational, linking it to the histories of colonialism, of the impacts on our body, parents' bodies, on their physiology, and how we can't escape it, that the body keeps score, that the body keeps record, that what we have inherited from, you know, for example, I'm Bengali, and, you know, the British created a famine when, you know, millions of people had died in Bangladesh. And as a result, our communities experienced stunting, which is that our bodies didn't grow or malnourished. So often you see Bengali people as petite and small. And those are, you know, physiological impacts of structural and colonial and racist harms. And we're still not connecting the physiological impacts of our environments and how they're designed, but also the everyday decisions, from microaggressions to the erasure, to not believing our pain, and not believing our pain showing up as, you know, disproportionate deaths in communities of color in custody, or the overrepresentation, as Marmot's work has shown, the overrepresentation of Black and brown bodies in mental health, but not when it comes to adequate physical health support. So I think that this moment in time really is calling us to, and revealing that our analysis around what health is, who accesses health, but also what the body is and what their body experiences is really coming to light. And if we want to have any form of approach that really holistically and robustly serves all of us, we do absolutely have to start at the margin, because the margin includes the nuance, it includes the subtlety, it includes all the ways that we're already innovating and surviving. And if we work from the margin, we will absolutely support, we won't be able to avoid supporting the whole. And so the lived experience, the racialized experiences that we, that Natalie so profoundly brought into this space are more than necessary to be included, but actually our political strategy, that they are actually our political strategy. And so why that brings us to trauma is, you know, I'm really mindful of talking about trauma, because trauma is an emerging field, and especially because of the ways that Eurocentric models of knowledge have approached trauma. You know, trauma is something in the unseen, though it has physical manifestations. So there often is, has been that trauma is something that doesn't exist. Or, you know, last week I was speaking to an academic at Oxford, and, you know, they kept saying, separating mental health from physical health, as if they aren't connected, as if, you know, there isn't physical implications to what our mental health is experiencing. And these are leading academics who are still not understanding the correlation between our body and our environment and our experiences. So while I want us to talk about trauma, the current apparatus that we have and what is available to us, because it has been led by a Eurocentric model, which is I think, therefore I am, causality and effect. So what you can see and what can be proved as the only way of verifying what a person's experiences, has completely led us to this deficit model, where we're actually inadequate to support one another. And what we need to be moving to, as Natalie mentioned, is being led by lived experience. What do people's experiences reveal about what health is, what a body is, what impacts us? But beyond that, why have we not believed those bodies? Because those bodies have already been speaking, those bodies have already been hospitalized, already been institutionalized. So what is the relationship to power and belief and trust, which brings us back to eugenics and brings us back to which bodies matter, which bodies don't, hierarchies of knowledge, colonialism, Western knowledge production, and really connecting with those aspects. And what is really profound, and when we think about these hierarchies of knowledge, and we're thinking about a COVID response and why Western knowledge production fails us so deeply, is that, as I mentioned earlier, is that it's connecting, it relies on dismembering the body, I think, therefore I am, to treat the body. And when we look at non-Eurocentric modalities of knowledge production, the body is a site of knowledge, that our genes reveal things, that our emotions reveal things, that ways and compasses by which we are informed of our environment, which we are informed of our boundaries. There's a profound amount of resources, and I can send some links. I'm watching that speak to this kind of analysis. But again, the hierarchies of knowledge have definitely minimized and erased and shamed out those ways of knowing. So how do we move forward from that? And how do we move past a dominance of hierarchies of knowledge, which have set us up to not know and to not understand, and therefore remain inadequate in supporting our societies to have the most robust health that is possible? One absolutely is being led by lived experience and centering lived experience, but in order to do that, to create the conditions and the capacity for people who are lived experience to lead, to have, as Natalie said, not to be racing for resources, but actually be able to show up, is that we do need to look at trauma. A lot of the times when we look at communities that have been harmed and marginalized, and we're not thinking about how to resource them, not just in a monetary sense, but actually create capacity for them in a day-to-day sense, in a real, material, practical way, then those people can show up with restored agency, because trauma removes agency. It makes us disassociate. It takes us away from our own lives. If people are then resourced and have the capacity, they are then able to lead and to be able to reveal and show in ways that are not extractive, but equitable, and aren't re-traumatizing, and do not come at the expense of our lives and our traumas. A third part of that is embodied, that we have to start looking at embodied knowledge systems, that oppression relies on us not understanding our bodies and living in a dismembered way. And when we start connecting with our body, we are able to move from a more holistic, more informed place. And so really understanding that there is no way to move forward without having a deeper relationship to our body, which then includes our environments, the natural, our physical, our structural environments too. A fourth is co-production and collaborative processes that Natalie also touched on, and also Lynn, of like deep listening, of understanding positionality, of building accountabilities within our environments and our collaborations. So really thinking about how we move forward in a way that, touching on the first and second point, that if we are collaborating, the lived experience and understand being trauma informed means whoever we collaborate with meet us in ways that are again equitable and progress the agenda and progress our ability to access health. A fifth is disability justice. Disability justice is a framework that really helps us understand which bodies are desired, disposed of, and valued, and it connects the structural oppression to health and our bodies. And when we start to understand and connect with the disability justice movement, we really see that we cannot avoid structural and systemic oppression of manyfold, from climate and ecological violence to gender to race, in any way forward, and that those that experience chronic sickness and disability are hold a genius and are already navigating what it means to live in chronically unsustainable worlds. And I think that's maybe on those 5 points. There are an abundant more ways and strategies, and you can look on Healing Justice London's website, where we discuss some of the strategies that we use that I've just touched on, in ways that we can move forward and actually have a political strategy around health, because it implicates all of us. I think I'm going to end here because I'm conscious of time. I really want to emphasize that curiosity and commitment that both Lynn and Natalie drawed out is really necessary in this moment to sustain us, but it also is calling us into a hard interrogation of our histories, of the ways that we interact with one another, but it's also a moment of profound opportunity, and that our bodies are at the heart of it, and our bodies are capable and have shown through the ways that marginalized communities have survived, racialized communities have survived, and still here, still creating, still living, still thriving, despite the conditions set against us, that we are able to really seize this moment and move towards generative and publicly led movement approach of health, where health is accountable to all of us, and that we are moving away from this privatized public health towards an abundance in public health. And that's what I'm really excited about and looking forward to engaging more deeply with folks here. Thank you.
Thank you very much. Wow. Yeah, it's not often your mind gets expanded in 15 minutes quite in that way. I saw comments in the chat from Alison around structural inequality, but that adds an absolutely new dimension to my perspective and what I understood that to be. So thank you very much, and thank you for creating that narrative flow from Lynn to Natalie to yourself, which was clearly there, but for articulating it so well. I see Sally's in the chat box going, we need to understand how we can do more on this. So we're going to give you a whole 30 minutes to think through to absorb that, and then think through what we need to do collectively as a sector. So it doesn't feel quite that we're giving the right space and the justice to this, but we need to begin to think what we can do. So if we could run the workshops, I've just got to extend the time of that workshop a bit till, if we could run it till 11:25, if that's possible. The question is, how can the voluntary sector in the Northwest best approach COVID-19 recovery in order to address inequality? So how can we as a sector approach COVID-19 or use the context of COVID-19 to address inequality in the Northwest? There's a number of sub-questions, but we may want to vary those given what we've just been listening to from all three speakers. The three sub-questions are: what are the big inequalities issues we need to address? What are the barriers to addressing that? And what needs to be done to overcome them? What do we need to do as a sector? So what are the big issues in the Northwest, which I think we've got a good coverage there of the beginning of that conversation, so don't spend too long on that one unless you want to. What are the barriers to overcoming them, and what needs to be done to overcome them from us as a sector? What do we need to do collectively? After that, we'll be doing feedback from participants from a nominated person. So keep an eye on the clock. There'll be a timer come up with 1 minute to go. If you have a chance, introduce yourselves to each other at the beginning. You'll have a pre-assigned facilitator, and most of the groups have got a scribe. The 2 breakout rooms without a scribe are being facilitated by Dan and Ed, and they'll support you in co-creating your notes. They're more sophisticated at this kind of stuff than the rest of us. So if we come back at 11:25, I know that's not long enough, it'll give us a chance to come back together and discuss this. But if we could go into the rooms now, please. So this is the plenary. So do you want to invite each of the, is there an order in which we're going round rooms, Michael? Do you want to prompt people as facilitators in order? If you do that, would that be useful? Sure.
Dan, let's start with you. You've been waiting here a while. Do you want to share what you discussed?
I mean, we started firstly with just the huge impact all that the speakers had really, and really opening up some massive questions and emotions. And one of the big challenges in that, when we start looking structurally, is knowing where to start and where to begin, and how you might create small pockets of change, but actually that then fading away when individuals move on, or that sort of thing. And really the heart of that being about the importance of ceding power both within the sector and within other parts of the sector. And as part of that conversation, we talked a lot about the use of medical language, the use of medical terminology, the way knowledge is produced and who it's produced by and who it's valued by, and cycles of identifying that there was perhaps a value in supporting different organizations, different communities to produce knowledge and produce voice in a way that connects and engages with the health sector to ultimately shift resources around, and that being a big heart of that question. And a big kind of end point of that conversation was that it's very flawed to think about recovery to a system that was unsustainable in the first place. And some of that language, we need to make a shift. We need to really spend some time interrogating, maybe transition is a better word, that what we need to move on to, what that looks like, rather than taking assumptions that looks like what it used to look like before, or that it should look like that. And having that conversation is, the first step in that is really trying to understand what tools do we as a region and as a sector have to gain knowledges, to learn and to understand what that should look like, and to engage and ensure a range of different positionalities come into that conversation. I think that's everything.
Lovely, Dan. Is there anybody from Dan's group who wants to add anything to that feedback? If you raise your hand in the chat box, we will bring you forward. The glare will be upon you. No, lovely. So if we thank you for the summary, Dan. So I've got the list in front of me now, Michael. So if we turn to Sally, do you want to do 3 minutes from your group?
Okay, so I think like Dan just described, we well, Joe helped us all express our feelings and emotions, which we were all a tiny bit shell-shocked, because for what Natalie, Fazana and Lynn had talked about was really powerful, and so we that started off the kind of conversation. We didn't talk about any other big inequalities except the ones that had been explored, but we talked a bit about the barriers and what we felt had been happening over the last 6 or so months. We had a conversation about funding and how the kind of drowning of the funding market with small grants to tackle the kind of inequalities that we talked about probably wasn't a helpful approach. And what we potentially needed to do was to be having more honest conversations with funders. Certainly Jill in our group talked about, you know, we needed to set out what was required from funders so that we could get that and achieve that. And if we were struggling with the voice stuff, that we all needed to do that, because funders potentially think they're being helpful, but that might not be hitting the mark in terms of making the difference. I'm just going to give a few headlines. So we talked about permission to collaborate more and to work together more. So that was really about how we come together and work together. Space to make mistakes, because we think we're likely to, as we start to do more on addressing inequalities. We talked a lot about personal and professional responsibility and what more could we all do, and that we needed to spend. So I think a few of us in our group expressed the idea that it had made us. There's an uncomfortableness about it, isn't there? That we aren't doing enough when we might have thought that we were, and what more we can do on that. And spending more time feeling uncomfortable felt like the right thing to be doing. And then we had a bit of a conversation about the distance between some of the meetings and the rooms and the colleagues that we spend our time with, not in our sector necessarily, but across the patch, the distance between, you know, like those challenges and that level of conversation and debate from kind of policy makers and decision makers. And there's much more to be done. So Warren, you'd put in the chat, I think at the very beginning, we should be talking to our DPHs, but I think like us, they'll all, you know, they won't get it necessarily immediately, the stuff that Fazana was challenging us on and Natalie talking about. So I think that's probably it. That's what I recorded. Laura took our notes and I made the offer to colleagues. 3 cheers for Sally's mum, Kat said, of course.
Is there anybody from Sally's group who wants to add anything to that feedback from there? Maxine encouraged in particular, given it's her birthday, I understand.
So Maxine wasn't in my group, but she's
was
more
she
than
not? I
welcome
thought she
to,
was
say,
from the chat.
to say something about it.
Right, no one there. Right, fab. If we move to Dave's group.
Yeah, thanks, Warren. We did a quick catch up. We felt that obviously the major issues were explored, obviously by the speakers, but we did a quick catch up and felt that the element of digital exclusion possibly hadn't been picked up sufficiently. So we wanted to raise that one. That then led into a discussion, obviously, around barriers and sort of basically the use of online can be good in that it has allowed services to go a lot wider. Also, it has created new barriers in terms of people who haven't been able to access services. And also, I felt the feedback I've had from particularly working and seeing reflections from young people is that they haven't been sort of willing to engage in the depth that they may have done through more face-to-face means. We then looked at what then needs to be done. There was quite a lot of talking about how we create cultural partners, so encouraging groups to form relationships with other groups where they could walk sort of the mile in each other's shoes. But there was a key thing that came up towards the end of the discussion, which was about inequalities around funding. I think that was one that's already come up, and really the drive the bottom with people becoming very competitive that we'd not seen for a couple of years. So there was really a request for funders to go back to some of the wanting to create real and genuine partnership. We know that takes time, and a lot of the COVID funding with emergency get out quickly. As a result, a lot of groups missed out, and in particular there was a lot of very false partnerships that were only being set up to get money rather than genuine work together and collaboration. Also, last point, that we need to recognise we're social beings. So whilst this is great, there's an element that we still need to find a time for our staff and our people. Hope, you know, obviously COVID safe, but we have to find ways to work differently. Walking in parks, meeting outside where it's safe, keeping that social distance, but we can't afford to just say we just do it via this means. Tessa and Maxine, I can see you on my screen, and Tom, anything you quickly want to add in 1 minute?
No, having a coughing fit.
If you want to raise your hand, I will unmute you if you want to say. All right. All right. Thank you, Dave. If we move to Ed.
Hi. So our group had, I think the main things that were coming out in terms of the emotions in the session, I think were there was a lot of tiredness, frustration and anger that was coming out, and kind of well balanced with lots of listening, I think. We sort of moved quite quickly to think about the kind of introductions also led into what I guess some of the issues around inequality were for the members in our group. So we talked quite a bit then about the barriers and just picked out kind of three themes really. So one was about remunerating organisations for their work and their expertise, particularly BAME organisations. So and lots of discussion about since Black Lives Matter and the high profile that's now come in. Great on one level, but also what that's led to is essentially those organisations, many of whom have got an average turnover of £10,000 a year, providing free consultancy to white-led organisations, which just makes me think back to a friend of mine saying, you know, particularly back in June, just saying, go and do the reading yourself, go and educate yourself, stop asking me all the time for what the answer is. So that was part of that. We then talked also about the kind of fear of speaking out that kind of happens within the sector. So when organisations are not necessarily treated equitably, like there's not really anyone to go to about that, because you know the same people that you might complain to or raise that concern with are the same people with their hand open offering to feed you. So you know the old adage of don't bite the hand that feeds kind of comes in and leads to a suppression of the openness of the structural issues that exist. And then we also talked a bit about how that overall those kind of elements combining together to this idea of that BAME organisations are kind of a perception that they or an experience that they feel as second-class citizens within the third sector, which I think is very interesting because the narrative is often about how the third sector is kind of united and gathered together. And I just wonder who's saying that and what their perspective is and what their experience is, because there's clearly other parts of this sector that aren't experiencing that. And so even, you know, getting a seat at leadership forums and situations like that, it's kind of like looking around the meetings, who is there and what is their background, and also what's the size, who's being remunerated for that. So we were talking then about like, again, the whole conversation could have gone off in all sorts of different ways, went quite specific and targeted and went, okay, so what could we do within the sector initially, recognizing that there are lots of structural and systems things. And what we ended up looking at was about this idea of like one thing that everyone in the sector could do, every organization, is could revisit our norms. Okay, and with a piece of work you're about to do, or someone you're about to, or a post you're about to hire, or a round table you're about to organize, is have a look there and see, is there equitable representation and remuneration for the people there, and also participation, and particularly when we're thinking about BAME communities. And we had a side discussion about whether that term was the term we wanted to use, but we accepted that that's probably the most helpful term to make progress right now. And that, because that would also lead into workforce development and all that as well. So that felt like the starting point, which is like, just take a look around and revisit what we think is normal and who is sat around the table.
Thank you, Ed. That was a rich
Does anybody from my
there.
group want to add anything else?
No, if we move, thank you very much, Ed. If we move to Jill. 3 minutes, Jill, by the way.
Hi, yeah. So when we were looking at the inequalities, we started off by looking at there is actually we saw a kind of northwest divide as well, partially between the northwest and the rest of the country, and linking into what the speakers were saying around some of the historical issues of inequality. that kind of intergenerational impact of policy on planning, on how we educate our young people, the kind of work that people have done traditionally within communities, and how that impacts intergenerationally on people's you know, physical health, their mental health, and their you know, the whole equalities agenda is really clear and stark. And we talked about poverty and hunger inequality and access to fresh food, and how we plan our communities, how we plan our neighbourhoods, and how we've done that over the generations has an impact to how people can access fresh food, and that fundamental you know, impact, if you can't get healthy and fresh food, how that impacts on your physical and your mental health, and your, you know, your contribution to your community is absolutely massive. So we looked at some of those, about transport inequalities as well, and what actually, you know, what work is available. So obviously unemployment, but also the 0-hour contracts, and the impact that has on a range of equality issues. Also, we talked about that within some communities where you have deprivation and more wealthier communities sitting in potentially in one local authority side by side, and how that can impact on how communities feel, and how they then contribute. That's a really interesting issue, and that led us on to talk about some of the barriers, and in relation to COVID, I think that what was coming out for the sector was that kind of firefighting approach that we've all had, that we had initially in lockdown, and that, you know, having to respond very quickly to an ever-changing set of circumstances and it's been actually quite difficult to sit back and look at some of those wider inequality issues and addressing those, because you're in the moment trying to address, you know, and respond to an emergency kind of situation, and then having to sit back and think about that forward planning and how we move forward as a sector while still being in the moment, finding that space to think, finding that space to collaborate when you're actually in the moment, and families that you're working with are in crisis, and how challenging that has been over the past you know, few months, and how exhausting that can be as well. So it's almost not been so easy to look for some of us strategically when we've been really you know, kind of stuck in the here and now, but also looking at irrespective of COVID, the lives of the people that we're working with, pre-COVID, this has just shone a light on those inequalities, which again links to what our speakers were talking about earlier, that shining a light on something that's been a historical issue, and the barriers have been long and historical in the making. And then we moved on to what we can do as a sector, and I think there is that general feeling of the enormity of the systemic change that's needed, the historical nature of what has led up to this moment can almost be overwhelming about, well, what can we do? And we don't want to become those cynics that kind of sit and think, well, there's nothing we can do, so we don't do anything about it. And we've never been like that as a sector. So we talked about what we can do as individuals, and the personal being political, and how we can, the work that we do with our communities and with those families, and the importance of being in that moment with those families and affecting change is really, really important. So actually just the work that we do that contributes to some of those, you know, those individual lives being led, maybe potentially for that moment, for that day being better. It's really important to keep a hold of that, whilst also looking collaboratively as a sector at how we can have a collaborative approach and how we can work together to create some of that groundswell to maybe open doors more strategically, to advocate for people, and the role of devolution in that. So the role of proper and true devolution, not devolution by name only, that could have a real impact on our communities. We also talked a bit about teaching politics and doing that on a very individual level and organisational level, about enabling people and communities to really think about changing situations politically, but also about empowering and doing that in a really grassroots way and enabling people and people with lived experiences, that as a sector we can really play a part in getting their voices collectively kind of listened to. And we talked about, instead of giving hands out, giving hands up, and really trying to create a situation where what we talked about, that participatory democracy, is really done from the grassroots upwards. So we're doing the do, we're enabling people to try and have their voices heard, and what we can do collectively as a sector to have those voices heard at a more political level, whether that's through devolution or not. So I hope I've tried to pull together some of the threads that we discussed. If anybody's got anything else from my group to add to that.
Anybody wants to add anything to Jill's feedback from that group? Lovely, thank you. I'll do the last group is our group, which I think we also discussed having a space to learn, collaborate and share. So I think that's a key action for us going forward. It's, you know, I'm not sure we could ever do something as work quite as well as the presenters gave us today, but we need some of that space to be thinking through those conversations in a way that we can get a chance to pay a bit more justice than we have today, possibly. In terms of our group, we were, you know, clearly it's poverty, clearly it's BAME. In terms of the inequality, we think it's also disability, class and ageism. The one protected characteristic we think is getting a bit buried at the moment in terms of the conversations is around gender, and there were concerns around mental well-being if that fits into the inequality criteria. In terms of actions for moving forward, Ben promoted the Akivo report, and the three that he's picked up that he's particularly interested in as a chief exec are around anti-racist training, shared work on BAME recruitment across the Northwest, and some way of supporting a BAME staff support network within the voluntary and community sector. The other key areas we picked up on were around having that reflective practice support for our staff, or whether it was mental health first aid training or something around just well-being training for our staff, and thinking through how we support them. The other key action we talked about was voter registration. So it was an interesting approach to thinking about how we might work collaboratively with the TUC around a very direct piece of democracy and supporting communities across the Northwest who were underrepresented to be better represented. And the only thing that I came up with was a really dull data one, which is around having the right dashboards. So I'm conscious this time we've got very much a number of people going to hospital that have COVID. And in 2008, we had very much economic ones around people seeking welfare advice and benefit support and debt advice. And I think we need those two alongside something around the social impacts of this crisis, and we need that writ large. So whether it's on the town halls of the Northwest instead of the Greater London Council, some kind of metrics for what's happening to our community so we can see what's happening. And that conversation is front and centre when it hasn't been in the past. Right, so we've run right over there. Could I ask, I was going to ask Natalie and Fazana just to share their thoughts or final comments on the day so far, and I'll stop talking. If I go to Natalie first.
So I think I'm, I suppose to some extent, a little bit taken aback and kind of humbled by how receptive everybody has been, because often when talking on these topics, people can become quite defensive, and then they stop listening or try to find another way of explaining the inequalities that we see. But I think the fact that you have, all seem to have received it so well and are actually really thinking about the practical things that you can do to make a change is really encouraging. So I would say kind of keep on, and I'll be watching this space.
Thank you, Natalie. Fazana.
I completely agree with Natalie. I feel like there's nothing I could add beyond that. We know the legacies of resistance in the Northwest, and I think something that I might share, because I think it's a really valuable wisdom that an elder, Dr. Cheryl Grills, whose work I think everyone should be looking at. She founded the Black American Psychiatry Network, and she said, she cites an African proverb that we are each other's medicine, and I think this is a time where we're going to have to ride some really profound waves, and also that there are increasingly hard conversations, and the curiosity that you've come with and the receptivity means that having this kind of movement approach, this collaborative approach, will take us further, and I'm really excited to see what unfolds. And just thank you for inviting me, and I always love getting to spend time with Natalie too, so thank you for putting us together on a panel.
Thank you, both of you. I think frankly you didn't give us much choice. You were so clear and articulate on what the challenge is that I don't think it took us much prompting to want to be doing something on these lines. So thank you both for wonderful presentations from both of you. And I think I've seen lots of stuff in the chat where people are talking about how it's changed their perceptions. So thank you very much. It's not normal feedback I get for any of my speaking presentations, but it's just been amazing to be part of that conversation today. So thank you both. I'm not going to try and recount the key discussion points from today. There's too much in there. I need a chance to digest some of it. So what we'll do is pull those together in terms of key actions. What we've been doing with the assembly events in Liverpool City region is coming back with kind of draft reports and then consulting. So rather than it being you did the event, you went away, we know what you thought, see you later, we'll try and engage you in that kind of conversation. And at the very least, we'll see if we can feed this into, very dull, but Voluntary Sector Northwest's strategic plan for moving forward, but then see who we can get on board and where the partnerships need to land. I think there's some clear asks in terms of quick wins for me around talking to Health Education England around what kind of support they're putting out across the Northwest that we could, for want of a better phrase, piggyback onto and see if we can offer those supports to the wider sector. But there's more than that to be done, clearly. If you would fill out the online monitoring feedback form as soon as you're off the call, says Michael, or he will chase you. So Michael's going to post a link in the chat, and if we could also send that link on to everybody, because I know a couple of people have had to go off for other meetings, given all the emergency meetings that are going on. I can appreciate that. If we could remind everyone, this is the first of hopefully 4. We've got 2 more booked in. The fourth one is not confirmed because it's the one with the 2 Metro mayors who've been busy. So we'll book that in, and whether it's build back better from them as it has been in the past, or see if we can get them to do no going back, I think that would be really useful. The COVID-19 infrastructure one is for infrastructure people, and that's next Wednesday, the 28th, 2 till 3:30. Our AGM and Beyond 2020, which was due to be the culmination, but is now the 3rd event on the role of the sector with leaders from think tanks and funding bodies. So we've got somebody from the lottery, is on November the 12th, 2 till 4:30. So if you're a member in particular, please make sure you're there and telling us what we should be doing. Membership to VSNW is free. Michael will post a link to our membership page in the chat, and we'll send that on after the event as well. So if you want to become a member and you're not, please do so. I often talk to people who think they're members but haven't actually signed up and haven't yet got the permission to bully me into doing what they need me to do. So please make sure you do that. Thank you, everybody. I'm sorry we had to cut short the workshop conversations, and I know you didn't get a chance to quiz thoroughly for Sana and Natalie at the very end, but it was nice to hear their thoughts on today, so thank you. So we'll see you all next week on the 28th, or if not, on November the 12th, and hopefully I'll bump into lots of you before then. All right, thank you, everybody. Bye.